Hello, everyone. Welcome to STEAM with Chantel. I'm here with Dr. Steve Davis, the Medical Director at Jessamine County Health Department. How are you today, Steve?
Hi, good morning, Chantel. How are you?
Good morning. I'm doing pretty
Blessed.
good.
Thank you so much.
I appreciate you meeting with us today, and I'm going to ask you 4 questions. So let's
Sure.
get started. The Health Department offers free drive-through testing to anyone, including Jessamine County residents. What would you explain the process?
Sure, Chantel. Thanks. And thanks again for giving the health department the opportunity to reach out to all of our folks in Jessamine County. It's just, you're doing just a tremendous service. And thank you. Thank you so much. Our testing service for COVID, we really have, like the old saying says, we think we have it down pat. First of all, what you would do, you would go to a website, jessaminehealth.org, or if for some reason you didn't have access to a website, you could call our health department phone number, which is 885-4149. And on that website, you will see a button to push to register for COVID testing. Now, our testing process is completely a drive-through process. You never have to leave the car. From the time you arrive in the parking lot until the time you leave, regardless of how many cars you see there, I can almost guarantee you that you won't be longer than 15 minutes. Your first station that you'll stop and register in, you'll be given some education about COVID, this enemy we're fighting right now. So you'll receive some written information. You'll then proceed to the testing tent where you'll meet one of our 3 nurses. And I can tell you, we've performed over 6,000 tests, and our nurses are extremely proficient. We actually, you'll pull up, put your car in park, turn your engine off, roll your window down, and they'll have a small Q-tip. And I can tell you, Chantel, our Q-tips, they're as tiny as about the tip of an ink pen. They're literally that small in diameter. The nurse will insert the Q-tip for just a short distance into your nose. They will spin the Q-tip around. The entire procedure from the time they put the Q-tip in your nose until they remove it takes about 5 or 6 seconds. At that time, you will be able to drive on and you will receive a phone call from the health department as soon as our test results are back, letting you know whether you had a negative test or a positive COVID test. And we're very fortunate that we've been able to get our results to people almost 100% of the time within 48 hours. So again, jessaminehealth.org, or call our health department 885-4149, and let's all get tested. It's just so important.
And why do we need testing?
Until that's a great question, and one that a lot of people ask. And here's the way I like to explain it to folks. This COVID-19 virus, think of it, we are fighting an invisible enemy. There's an enemy that's invaded us, if you will. And what this enemy does, it will attack somebody. Fortunately, most of the people that it does infect, praise the Lord, most of the people do not get very sick with it. However, as we know, there have been some tragic results in people who have been terribly sick or have even passed on as a result of this virus. So the reason we want to get tested is to find out if we happen to be carrying this virus. As many as 50% of the people that are in our community and in Kentucky and in our nation can be carrying this virus and not even know they have it. So think of that, 50%. So you don't even know you have it. And what's so important is that if you find out you do have the virus, then we can help you with information to help you stay healthier during your period of infectivity. We can help your family by both you and your family staying at home for a period of time that would be determined depending on the situation. And then we could, in doing this, actually, by you not moving about throughout the community, that helps so that this invisible enemy doesn't spread from yourself to then someone else who could possibly then get terribly ill with the virus. So testing is very important. We need to identify who has it. We need to identify who has been in close contact with someone who does have it, because the entire goal is to help you, to help your family, and to help our community. Because this, right now, until we get a vaccine, Chantel, testing and community protection, family protection, this and the other public health measures that I like to call the 3 W's, which is watch your distance, wear your mask, and wash your hands. That's what we have to fight this invisible enemy, and we're going to whip it. We're not going to let it whip us, but we all need to get ourselves tested so that we can play our part as a community in helping one another out.
You're completely right. Safety and education is key, and I like the 3 W's. I'm going to remember that. My next question. I know the other type of testing identifies whether antibodies to the virus are present in your blood. Can you tell us STEAM lovers more about what are antibodies?
Sure. Everybody has, as part of their body, we have something called our lymphatic system. People have heard of lymph nodes. Your spleen is part of your lymphatic system. And what your lymphatic system does, think of it this way. I like to explain it when I'm talking to patients or teaching in classes. Your lymphatic system develops, think of it as little soldiers. And these are little soldiers called antibodies that get in your bloodstream. And what they do when they recognize that a foreign virus, a foreign germ, something that's not normal to your body, they then travel through your lymphatic system, through your blood system, and they go to try to, as a soldier, if you will, defeat that enemy that's invaded your virus. That's invaded your body. And in this case, it's the COVID virus. So we can make antibodies against viruses, we can make antibodies against bacteria, et cetera, et cetera. But again, just think of it, it's your body's defense mechanism to try to fight off whatever's invaded your body in terms of a germ that's wanting to make you sick. I will tell you with antibody studies right now, there's kind of 4 situations that's come out of the study since began early February, following patients who have developed the COVID-19 virus. And those 4 situations with antibodies, they go like this. First of all, some people don't make any antibodies. They get infected with COVID, but they don't make any antibodies. So when they get an antibody test, it may come back negative, and that's just because for some reason their body didn't develop the antibodies to COVID. The second thing that may happen is you may develop antibodies, Chantel, but those antibodies need to be what we call protective, meaning neutralizing, meaning they kill the virus. And some people develop antibodies to COVID, but they don't completely protect you against that. And I like to describe it as like having a cookout, and suddenly you're around a little campfire and you poured a little water on it, but you didn't pour enough water on it to really put the fire out. And so those are antibodies that what we call, they're COVID antibodies, but they're non-protective. The third group of people is they do develop the antibodies to COVID-19, which is good. They develop the protective antibodies, they're protective, which is good. But then all of a sudden, maybe around 3 to 4 months, those antibodies just suddenly leave our system, meaning they don't stay with us throughout our lifetime like we want them to, like for instance, measles antibodies. We know right now, hopefully that remains a lifetime antibody. But the fourth situation is good news, is that you can have antibodies that you develop against COVID-19. They are good, strong antibodies, number one. They're protective antibodies, number two, meaning they go out and they really kill that virus. Number three, they stay in your bloodstream at a good level. And number four, they've been staying at a high enough level since the beginning of February till now. Some people are maintaining those good high-level protective antibodies throughout the course of the COVID duration that we've known it. So yes, you can have a blood test to determine if you've had antibodies. The only thing, there's a little caveat in that, is those antibodies can be in one of those four categories. You don't really know which category you fall in, but certainly, as I say, until we get our vaccine, which prayerfully will be coming very soon, let's just remember, everyone get tested. Let's all play our part in being part of a community that says we're not going to let this virus whip us. And let's remember our 3 W's. Let's wear our mask, let's wash our hands, and let's watch our distance.
Thank you so much, Dr. Davis. So for the kids watching the show, when I'm listening to you describe antibodies, I'm visualizing like the Pac-Man game.
Exactly.
There we go.
That's a one. Thank you so much. And I'm old enough, I can remember when Pac-Man first started. They're like little soldiers that they're like the Pac-Man. They see a strange virus or a strange bacteria that's entered our system, and those soldiers say, let's go get it. And they send out, like the antibodies act like Pac-Man, and they go out to try to gobble them up to clear your bloodstream and your body of the infectious agent. That's a beautiful way to put it. Thank you so much.
Thank you so much for your time. I appreciate everything that you did today. You've helped me to visualize it and helped it not to be so scary. Education is key. And I appreciate you.
Thank you so much. Thanks for all you do, and God bless you, and you stay healthy out there.
And thank you all for tuning in to Sting with Chantel. I'll see you next time.
Bye.
Bye.
Thanks for checking out this video. If you enjoyed it and want to know when JCPL puts out more content, click the subscribe button and a notification bell. We have something for everyone on our channel, so be sure to check out the other programs we offer.